Hi. So just as we have the outpatients where we can attend to patients that came for an encounter or a consultation, lack of better word, right? We also have what we call the inpatient module. So this module helps us we differentiated these modules in a way that we see it as the outpatient is for everything that has to do with outpatient. The inpatient is for everything that has to do with inpatient, right? Be it pre admission or even post during the admission and also post admission, that is after discharge and all, right? All of those records can see like there may be if a patient is fully discharged and also see those records, right? So how do we navigate to this place? We have this button here that says inpatient. This only just switches this interface into the inpatient module. And as you can see here, we have patients that are uh, currently admitted. So the only time you would see patients that are currently admitted is if the nurses have assigned a bed. But peradventure a bed has not been assigned, we'll see it as pending admission, right? Now, how do we attend to this patient? Also before I attend to this patient, we have filters that we can filter by what or even by status of the patient and also search for the patient, right? Now, we have this view here that looks like a widget. There's also the view that looks like a list. By clicking on this particular interface changes to this, and we can see the patients that are admitted as a list. So whatever suits the user, they can either use this view or use this particular view. But I prefer this view, so I'll be going with this. So I click on this details, shows me the basic information of the patient, the admission information, that is the ward, the bed tag, admitted by, even the instructions by who admitted this patient. You can also see the sponsor information, if it's insurance or self-pay. If it's an insurance, you see the sponsor name and then the sponsor plan, right? Then we also can also see the next of kin details, right? So continuing why we came here, I click on this and then click on attend to patient. So this takes us to the inpatient documentation of consultation dashboard, for lack of better word. The dashboard allows us to do our documentations for each of the ward round, and then also maybe book. There's a patient plan, we need to book medications, or to even eh, so we this page is being engendered, right? We can see the vital history, and it's also segmented in different types of menu. You have the general menu, labor menu, right? We have the surgery menu, we have the antenatal menu, we have the newborn menu, and we have the discharge menu. Typically, we just grouped everything. For the general menu is where most of the documentations and the plan happens, where we can enter a chief complaint if there's a need to, or maybe the system review, right? Where we can click on new review, enter what applies to that particular patient, right? And the other symptoms with diabetes, what we've seen, let's see, other symptoms, right? And I say, right? And I click on OK. And we also have physical examination. There's a need to enter. Now, for how do we then now document the our observation during the ward round. We have this ward round notes. This allows us to click on take new record, the complaints. There is a new complaint, right? Let's say the patient complained of headache, right? Our findings, let's say spoke to the patient, or let's say acute, um, and some other basic, and some other clinical findings, right? Then the condition of the patient, is it status quo, has it improved, is it stable, clinically improved, clinically unstable, and all, right? And also still on this same model, we can also book new investigation if there's a need to, right? Or even book a new medication if there's a need to, right? So typically um it's just the accordion. Yeah, this word round allows us to document everything of your findings during each word round. Right. There's also the ability to book a medication too from here, right? Where we can also see that we can also add a new drug and also send to the pharmacy once we prescribe the, the medication. Then we also have the laboratory investigation where we can book new lab tests, right? And then also view the nursing report. We can also view the acute analysis, right? What has been entered. Then we also have we also have other menus. So basically, this is how the doctor get to this particular admission page. And then once they are done, they can simply exit the admission ward. Or we use this link here that takes us back to the inpatient. Right? That is how we attend to patients as a doctor. Or that's how a doctor attends to patients on admission. Thank you.